The journey to becoming a certified nursing assistant (CNA) is a rewarding one, offering a fulfilling career path in healthcare. However, the path to certification requires dedication, knowledge, and a thorough understanding of the skills and responsibilities involved. The Master Certified Nursing Assistant Malpractice exam serves as a crucial stepping stone, providing a comprehensive assessment of your readiness for the actual certification exam. This guide aims to equip you with the knowledge, strategies, and resources to conquer the malpractice exam and ultimately achieve your CNA certification. Understanding the importance of the malpractice exam. The malpractice exam is not just a test, it's a valuable tool for your success. It allows you to assess your knowledge and skills. The exam covers a wide range of topics, from basic nursing skills to resident care and communication. By taking the practice exam, you can identify your strengths and weaknesses, allowing you to focus your study efforts on areas needing improvement. Familiarize yourself with the exam format. The malpractice exam mirrors the structure and content of the actual certification exam. This familiarity reduces anxiety and helps you feel more confident on the day of the exam. Develop time management skills. The practice exam simulates the time constraints of the real exam, enabling you to practice pacing yourself and managing your time effectively. Gain confidence. Successfully completing the malpractice exam with a good score boosts your confidence and motivates you to continue your preparation. The malpractice exam syllabus. A detailed breakdown. The malpractice exam syllabus is comprehensive, covering a broad spectrum of knowledge and skills essential for providing safe and effective care to residents in various healthcare settings. Here's a detailed breakdown of the key topics. 1. Basic nursing skills, infection control. Understanding and applying standard precautions, hand hygiene, isolation techniques, and proper disposal of contaminated materials. Vital signs, accurately measuring and recording temperature, pulse, respiration, and blood pressure, recognizing normal ranges and variations, and reporting abnormal findings. Hygiene and grooming. Assisting residents with personal hygiene, including bathing, oral care, hair care, and nail care, respecting resident preferences and ensuring privacy. Skin care. Recognizing and preventing pressure ulcers, providing skin care, and reporting any skin changes or concerns. Mobility and transfer techniques. Assisting residents with ambulation, transfers, and positioning, using proper body mechanics and assistive devices to ensure safety. Bed making. Making beds according to facility protocol, ensuring proper linen changes and maintaining a clean and safe environment. Medication administration. Understanding medication administration procedures, including the 5 rights of medication administration, documenting medication administration, and reporting any medication errors. 2. Resident care, nutrition and hydration. Assisting residents with meals and snacks, providing appropriate dietary modifications, monitoring fluid intake and output, and reporting any concerns regarding nutrition or hydration. Bowel and bladder elimination. Assisting residents with toileting, providing incontinence care, and documenting bowel and bladder elimination patterns. Communication. Communicating effectively with residents, families, and other healthcare professionals, using appropriate verbal and nonverbal communication techniques, and respecting resident confidentiality. Emotional and psychological support. Recognizing and responding to resident emotions, providing emotional support, and promoting a positive and supportive environment. Safety and security. Ensuring resident safety, preventing falls, and reporting any safety hazards or concerns. Documentation. Completing accurate and timely documentation of resident care, including vital signs, medications, treatments, and observations. 3. Legal and ethical considerations. Resident rights. Understanding and protecting resident rights, including the right to privacy, confidentiality, and informed consent. Legal responsibilities. Understanding legal responsibilities as a CNA, including reporting abuse, neglect, and exploitation. Ethical principles. Applying ethical principles in resident care, including honesty, integrity, and respect for resident autonomy. 4. Common medical conditions. Cardiovascular conditions. Understanding basic concepts of cardiovascular disease, recognizing signs and symptoms of common cardiovascular conditions, and providing appropriate care. Respiratory conditions. Understanding basic concepts of respiratory disease, recognizing signs and symptoms of common respiratory conditions, and providing appropriate care. Diabetes, understanding basic concepts of diabetes, recognizing signs and symptoms of diabetes, and providing appropriate care. Alzheimer's disease and dementia, understanding basic concepts of Alzheimer's disease and dementia, recognizing signs and symptoms of dementia, and providing appropriate care. Stroke, understanding basic concepts of stroke, recognizing signs and symptoms of stroke, and providing appropriate care. 5. Emergency procedures, CPR cardiopulmonary resuscitation, understanding and performing CPR in accordance with current guidelines. Heimlich maneuver, understanding and performing the Heimlich maneuver to relieve choking. First aid, providing basic first aid for common injuries and illnesses. Mastering the McNaugh practice exam, effective study strategy. Assess on the McNaugh practice exam requires a structured and focused approach. Here are some effective study strategies to help you maximize your preparation. 1. Understand the exam format. Multiple choice questions. The McNaugh practice exam typically consists of multiple choice questions, testing your knowledge and understanding of various concepts. Familiarize yourself with the format and practice answering multiple choice questions. Case studies. Some practice exams may include case studies, presenting real-life scenarios and requiring you to apply your knowledge to make appropriate decisions. Practice analyzing case studies and formulating effective responses. 2. Create a study plan. Set realistic goals. Break down the syllabus into manageable sections and set achievable study goals for each section. Allocate time. Dedicate sufficient time for studying, considering your personal schedule and commitments. Prioritize topics. Identify your strengths and weaknesses and prioritize studying topics you find challenging or unfamiliar. 3. Utilize effective study techniques. Active recall. Instead of passively reading material, actively recall information by answering practice questions, creating flashcards, or summarizing key concepts in your own words. Spaced repetition. Review material at increasing intervals to reinforce learning and improve long-term memory retention. Practice questions. Utilize practice questions from the McNaugh practice exam, study guides, and online resources to assess your understanding and identify areas for improvement. Group study. Collaborate with other aspiring CNAs to discuss concepts, share study tips, and practice answering questions together. 4. Seek additional resources. Study guides. Utilize comprehensive study guides that cover the McNaugh practice exam syllabus in detail. Online resources. Explore online resources such as websites, videos, and interactive quizzes to supplement your learning. Practice exams. Take multiple practice exams to simulate the real exam experience and identify areas needing further study. CNA training programs. Enroll in a CNA training program to gain hands-on experience and practical skills. 5. Manage test anxiety. Practice relaxation techniques. Incorporate relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation into your study routine to manage stress and anxiety. Positive self-talk. Engage in positive self-talk to boost your confidence and focus on your strengths. Get enough sleep. Ensure you get adequate sleep before the exam to enhance cognitive function and reduce stress. Eat a healthy meal. Eat a balanced meal before the exam to provide your body with energy and focus. 6. Be prepared for the exam day. Arrive early. Give yourself ample time to arrive at the testing center, find your seat, and relax before the exam begins. Bring necessary materials. Ensure you have all the required materials, such as identification, pencils, and a calculator if permitted. Read instructions carefully. Pay close attention to the instructions and follow them carefully. Pace yourself. Manage your time wisely. Allocate sufficient time for each section and avoid rushing. Eliminate distractions. Minimize distractions by finding a quiet spot to take the exam and focus on the task at hand. 7. After the exam, review your answers. After completing the exam, review your answers carefully and identify any areas where you may have made mistakes. Analyze your performance. Analyze your performance on the practice exam to identify your strengths and weaknesses and focus your study efforts accordingly. Seek feedback. If possible, seek feedback from your instructor or a mentor on your performance and areas for improvement. The importance of continued learning and professional development. Achieving CNA certification is just the beginning of your journey as a healthcare professional. Continued learning and professional development are crucial for staying up to date with the latest advancements in healthcare and enhancing your skills and knowledge. Here are some ways to continue your professional growth. Attend conferences and workshops. Participate in industry conferences and workshops to stay informed about new developments, best practices, and emerging trends in healthcare. Read professional journals. Subscribe to professional journals and publications to stay current with research findings, clinical guidelines, and industry news. Seek mentorship. Connect with experienced CNAs or other healthcare professionals for guidance, support, and mentorship. Pursue further education. Consider pursuing further education, such as an associate's degree in nursing or a bachelor's degree in nursing, to expand your career opportunities and advance your skills. Conclusion: embracing the journey to CNA success. The journey to becoming a CNA is a challenging but rewarding one. By embracing the Practice exam as a valuable tool, utilizing effective study strategies, and committing to continued learning, you can equip yourself with the knowledge, skills, and confidence to excel on the actual certification exam and embark on a fulfilling career in healthcare. Remember, the Practice exam is not just a test. It's a stepping stone to achieving your goals and making a positive impact on the lives of residents you care for.